The invisible danger of high blood pressure. High blood pressure and kidney disease are deeply connected. One silently destroys the other. Damaged blood vessels reduce blood flow to the kidneys, and damaged kidneys raise blood pressure even more, creating a deadly cycle inside the body. The terrifying part: many people with dangerously high blood pressure feel completely normal. No pain, no alarm, nothing, until one day the damage becomes irreversible. Doctors around the world now call hypertension a silent killer for a reason, because it destroys organs quietly, and the kidneys are often among the first victims. A 42-year-old delivery driver thought headache were caused by stress. He kept postponing medical checkup, kept working longer hours, kept ignoring fatigue, until one morning he collapsed while getting ready for work. At the hospital, doctors discovered advanced kidney failure. He had never imagined his kidney were already close to shutting down. Healthy kidney remove toxins every minute, but when kidney function drops, waste begins build up inside the bloodstream, slowly poisoning the body from within. This condition is called uremia, and its symptoms can become terrifying. Nausea, vomiting, metallic taste in the mouth, severe itching, confusion, loss of appetite, bad breath, muscle cramps, difficulty thinking clearly. Some patients describe feeling like their body is slowly shutting down, because in many ways it is. Without proper filtration, toxins spread through nearly every organ system, including the brain. What actually causes kidney failure? Many people believe kidney failure only happens to the elderly, but doctors are now seeing younger patients more frequently, and some of the causes are hiding in everyday life. The biggest causes include diabetes, high blood pressure, excessive painkiller, obesity, smoking, dehydration, untreated infection, drug abuse. Even common medications can become dangerous when abused over time, especially certain painkillers. Millions of people take them daily without realizing the long-term damage they may cause. And by the time symptoms appear, the kidney may already be scarred completely. But perhaps the most frightening stage comes when the kidney finally begins shutting down completely. As kidney failure advances, the body enters survival mode. Fluid builds dangerously. Breathing becomes difficult. blood pressure rises, toxins overwhelm the bloodstream, weakness becomes severe, and even dialysis may become necessary to stay alive. 3 times a week, hours connected to machine that do the job the kidney can no longer perform. For many patients, life changes permanently, and some spend years waiting for a kidney transplant that may never come. The warning signs most people miss. The tragedy of kidney disease is not only how deadly it can become, it's how often the early signs are ignored. Because fatigue feels normal, swelling feels temporary, headache feels ordinary, and frequent urination feels harmless. But together, these symptoms may be the body desperately asking for help. How to protect your kidney. The good news: many kidney problems can be solved or prevented. Simple habits matter more than most people realize. Control blood pressure, manage blood sugar, drink enough water, avoid excessive painkiller use. Exercise regularly, reduce salt intake, stop smoking, and most importantly, get regular medical checkup, because detecting kidney problems early can save lives. Some diseases arrive loudly, others whisper for years before they shine. Kidney failure is one of the quietest killer in modern medicine, and that's what makes it so dangerous. The body often warns you long before disaster comes. But in busy lives filled with stress, work, and distraction, those warnings are easy to ignore. Today, somewhere in the world, someone is dismissing symptoms that could change everything. And maybe after watching this, they won't ignore them anymore. Because sometimes the difference between life and tragedy is simply paying attention before it's too late.